Bill, there's a current epidemic of depression going on in this country, and there's a recent television coverage of the studies at Harvard showing that it's very difficult to show any difference between a placebo, a sugar pill, and antidepressant medications.
I'm glad it's happened.
Yeah, and I'd also comment that in talking with my psychiatry friends, there seems to be a virtual disappearance of psychotherapy in modern psychiatric training. They've taken on the medical model, and medications are everything, and it's very difficult in some patients I've had more recently trying to get someone to do some listening psychotherapy. It's almost vanishing in psychiatry.
You're right. Yeah.
You can find psychologists who do that, but it's I don't say it's no longer part of psychiatry, but it's diminishing. You've had a long interest in depression, and I thought in this session, if you could lay out your thoughts about what is depression, what are the origins of it, and then I'll point you to a case you had of a woman who had abdominal pain and depression.
Sure. Good.
So have at it.
Well, first of all, depression, and I have found over a period of close to 60 years of practice that depression is based on one very significant part of how one considers themselves as one down. That's an easy word to use. But if a person does not have a negative self-image, they will not be depressed. And the book that you referred me to a while back, Bruce Lipton, was so wonderfully convincing.
That book was called The Biology of Belief.
The Biology of Belief by Bruce Lipton. Wonderful book. In the first 6 years of life, we form a script. We write a script for ourselves as to how to think, feel, and be in life. And whether people believe it at the time or not, but it's true that that script and its main structure, its main plot, will be carried out by each of us for the rest of our life. Because by the time a little kid has reached the age of 6, and his or her experience in life is nothing more than the four walls of home, primarily a mother who's in routine household that you and I know is the main caretaker and is with the child, first off, skin to skin, body to body. 90% of the time, mom is present in the child's world.
Yeah. Now you say that script is for life. It's not unalterable there.
It's not unalterable if a person is aware of it and chooses to change it.
So if it's a very negative script, you're not doomed.
You're not doomed.
With assistance and awareness later on, it can.
But the average person says, this is just the way I am.
Right.
This is just the way the world is. Well, here's a little kid with no experience outside of the home. He doesn't know that people over in this house or that house or another house are different. He figures that this is the world. He doesn't know any world outside of that. So based on the perception of the world and the people in it and how they are and act and feel, we make a decision, a lot of decisions, that the way to get along in the world is to adjust and adapt and be compliant with the things that happen in the world. Our world is grossly confined. If my mother has a degree of what you might call abnormal pathology, pathology means abnormal, path. If my mother has grown up, as she did, with a mother who died when she was 2 years old, and with a father who was in those days kind of remotely distant, as the doctor in a little town in South Dakota. My mother grew up very much afraid of the whole world. The world is a scary place. Grew up without a mother. She was shipped over to the grandparents on the other side who were very stoic, non-emotional, didn't talk to little kids about feelings, and little kids were supposed to not cry and deal with the world. Why? Because they went through prairie fires and snowstorms and death on the prairies of South Dakota. Stoic. My mother had to put a wet blanket on child feelings. My father had a brutal father who was actually beaten if he cried, physically beaten. My father, anytime he got into a warm, soft emotion, would leave the room. So what do you think he did if I, as a little kid, normally, naturally, would cry when I felt bad? He'd leave the room. So how did I feel? Unlovable. So I'm unlovable if I cry or evince fear. My dad leaves the room. And what did my mother do? Overwhelmed with concern because she never had anyone to turn to for her fears. So I make my mother feel bad if I have fear or sadness or tears, and my father leaves the room. So what do you think I did with those emotions? I put a wet blanket on them. In other words, if I had those feelings, I felt bad about myself. I was guilty.
Is that a common, not exactly experience, but is that a common kind of experience for people who have depression?
The depression is that I felt bad about myself for having a normal emotion. So anytime a person has a anger turned inward, guilt is anger turned inwards. Anytime a person has a negative self-image for having a normal feeling, they're going to have a degree of depression.
So that suppressed feeling, anger is the most common in depression. Is it universal for depression?
I was okay with anger.
Okay.
My father could be angry, my mother, hey, guard you. Anger was okay, but I couldn't feel sad.
So sadness, any of the other 6 basic emotions you enumerate, if they're suppressed, can that be the trigger for depression?
Exactly.
It doesn't have to be one of those 6.
But it doesn't have to be the normal. The one that you find most often is a wet blanket on anger.
Okay.
The next is on fear. The next is on sadness. Now, love, sex, and joy. What do you think Mom would not want you to talk about? Sex. So although sex is a completely normal emotion, the having of it, what we do about it, is what society says, and what Mom says, oh, you shouldn't talk about that. So of the 3 tough emotions that are normal, anger, fear, sadness, then we've got one that's commonplace, that sex in America, by most mothers' advice to their kids, is that these are things we don't talk about. So here I am feeling bad about myself for having normal emotions.
Yeah. Now, with that intro, I'm going to lead you to this patient you had.
All right.
Who had suppressed and repressed. Suppression or repression?
Well, first we have suppression, and then if we're suppressed enough, we will do it to ourselves and repress what we know, if utilized, would be suppressed.
If in the event in the future anger would be called on, it would be repression of that if you don't express it.
I would repress it because I knew my mother didn't like me if I did it.
Okay. Now, to remind you of this case, this is a 30-year-old professional woman with abdominal pain of many years' duration, and she was in group therapy with you and some other people. And when the group was involved, I'll read it here, in evaluating her attitude, she became angry that her nurturing nature wasn't evident. She winced, and further questioning revealed that the belly pain occurred when she was angry. You then led her into a two-chair Gestalt technique, which I hope you will now describe.
Right.
This two-chair technique on this patient and in general.
So here's a lady that got belly pain if she got angry. In other words, what couldn't be comfortably dealt with her mind, she relegated to her body. So you knew when she got belly pain that one of the emotions that she had was something she felt guilty about. Anger is what it was. So what I had her do was to sit in one chair and act way back like she was a little kid talking to her mother.
So she's in this chair talking to an imaginary mother.
To an imaginary mother. That's a Gestalt two-chair technique.
And you've asked her to move back into early childhood.
G-E-S-T-A-L-T, Gestalt.
Right.
Okay. So I had her say something from that chair to her imaginary mother, and she said...
Yeah, she said, by age 6, ask your mother how she feels about you. She says in this imaginary scenario, Mom, how do you feel about me?
And Mom responds with...
You're a nice girl, she says back to her. With tears in her eyes, she then asks her mother, do you love me? And with sarcasm, the mother says, isn't she sweet?
And by the way, with the mother's role, we have the person move over into the mother's chair and speaks now to the imaginary child.
So whenever this child asks the mother, she switches chairs and becomes the mother.
And becomes the mother. So her memory of how Mom might have said it is very, very powerful sometimes. And going back in there is enough to cause a lot of emotion.
And so she says, playing the role of the mother, with sarcasm, isn't she sweet when she talks that way? Then with raging tears, you don't even listen to me, I'm not here when you talk to me.
And I have her change chairs, and now the little girl's talking to Mom and says,
you don't even listen to me, and I'm not here when you talk to me, I hate you, I hate you. She begins sobbing, and you ask her when her anger had gone, and she burst into fearful panic and tears and cried, I want to tear my guts out. I'm so terrible, I want to kill her. Oh God, I want to die.
That's right, because now the child is so angry at Mom for discounting her feelings, and yet she's so dependent on Mom and knows that it's a terrible thought to want to kill her mother. So she's torn between knowing that it's horrible to think and feel that way, and yet from a child's standpoint, that's the way she feels. So she's in a bind, in a double bind. She needs her mother. She knows the rules say, don't be that angry, and yet a part of her normally wants to be angry. But her mother has never allowed her to have her normal feelings.
And you say that in this one session, 50% of her abdominal pain was eliminated. When does that happen, and how does the technique alleviate? She gets the story of what happened, imaginary.
Once she allows herself to come out with a feeling that she's suppressed for a lifetime, she's aware that the feeling is normal, and that as a child, it scared her to death to think that she might actually be killing her mother. But in today's world, when she goes back, and it's called enactment, they reenact the scenes of her childhood. So she realizes that her anger has been held in, and when she lets it out, now in group therapy where we are, and it's the normal, natural feelings of her childhood, and nothing bad happened, because her mother isn't killed, and her mother isn't even there anymore.
Right.
But she says to herself, my God, here I am angry, and nothing has occurred. Why am I afraid of being angry? She drops her guilt for being angry because she was angry with no consequences. So she recognizes the difference between the normalcy of anger and it's what you do about. But the child doesn't realize that responding and acting on the anger is not part of the anger.
Is the group session important in this? The group
It
acceptance?
doesn't have to be, but the group is important because they support and add confidence and
We're okay
more
with
or
that.
less nurturing to the person going through this extremely.
They condone the early anger.
Exactly, exactly. Anger is normal. It's what you do about it that counts. But see, the little child in us, you and I, all little children, don't really know the difference between the action and the feeling and the having of it.
How often is that background of suppressed and then repressed anger the cause of depression?
I would say easily 75%.
Earlier,
Anger's the big deal.
Okay. Earlier in our discussions, we got into the measurement of neurotransmitters and chemicals circulating in the body, whatnot, in depressed people, and how the prevalent belief is that those chemicals are primary causative for the depression.
Right.
Discuss your idea and thoughts that those are consequences.
You want to do that in this segment or
Yeah.
move on? Okay. We have a normal range of blood levels of these chemicals. And under stress, our body normally changes those levels of norm. Under emotional stress, our body's mechanisms of chemicals alter. What the modern scientist has done is to somehow believe that the change in chemicals are the cause of the feeling, which is completely wrong.
So
it's the feelings that cause the chemical change.
So with antidepressants, they're chasing the chemical responses to a normal emotion over here, or exaggerated emotion, or whatever, and that you're saying, and they're saying the chemical changes is causing this. You're saying the emotional state and whatever
Right.
emotional reactions is producing the chemical changes.
Undoubtedly.
They're very opposite to what modern science is saying.
Exactly, because
And-
modern science produces pills which are antagonistic to the chemicals.
And now they're saying that the placebo is not any better or different than antidepressants.
And now they're finally recognizing
That the emotional state can reverse the chemical changes if they
And,
believe they're getting a pill that's effective.
exactly.
Okay.
Now we've gone back to saying that the chemicals are mind caused and the chemicals can be mind cured, in other words, brought back into a normal range by just thinking differently.
Right. I'm going to say let's end there, and the next segment we're going to have is going to be two fascinating cases that you had and were helpful.